When you talk to a group of high schoolers and you ask them what they want to be when they finish school, when they grow up, they say lawyers, doctors, nurses. Not one of them will raise their hand and say, I want to be a drug addict. This bill is very personal to me. I had one of those children who at 16, she's honor roll student. She worked her senior year, 17, working 50 hours a week, going to school, finished the A+ program, accepted into SLU for the physical therapy program. Very bright, head of the drama team at church. She cut her thumb at work, and she cut her thumb at work and went to get stitches, and they gave her a script of Lorcets. She worked in a restaurant in town, and from that point forward, she just started buying them. And that was something that a lot of the kids did. When she got to where she was taking anywhere from 30 to 60 pills a day, she switched to meth because it was less expensive. It was something she could afford. And by the time you have that type of a drug addiction, you're pretty much just doing whatever. Prescription pain pills are legal, and kids don't look at them as heroin, but it's opiates, is the same thing. And parents don't look at it that way when they have their bottle in the medicine cabinet. So many times, the addiction is very innocent. That leads to death. We've been very blessed, and my daughter has gone through many years of struggling, 12 years of ups and downs, and she's 7 months clean now. But you know, she didn't finish college. She went a few weeks into college and dropped out because she couldn't handle it with the drug addiction. Pushed all of her family away. But these are the things that we're seeing time and time again. Missouri is the only state without some form of a PDMP, a prescription drug monitoring program. More Americans abuse prescription drugs than cocaine, hallucinogens, heroin, and inhalants combined. This is a national epidemic. Last year we passed this same bill, Representative Engler's bill, with bipartisan support of 112 yes votes. We've had many that brought up the privacy issue, and I'm someone who is very concerned about our privacy. However, this is no different than medical records. Your pharmacist is inputting the information as they're filling your script. Your insurance company has this information. This falls under the same HIPAA requirements and laws as electronic medical records. I'll hit a few points in the bill. It requires the Department of Health and Senior Services to establish and maintain a program to monitor the prescribing and dispensing of all Schedule II through IV controlled substances. This doesn't include your psychiatric medications, your antibiotics. These are the narcotics that are commonly abused. All funding for the program must come from gifts, grants, and donations. Requires each dispenser to electronically submit specified information to the department in accordance with the current transmission standards for pharmacy automation, and to report the data within 7 days. And what this does is if a doctor has prescribed, Missouri has a lot of what we call doctor shopping, since we are bordered by 8 states who have some form of a program in place. And what we see down in the Boot Hill, and what I've understood from now talking to people all over the state, is very common in Missouri. We have folks that will go to multiple doctors, get the same script, go to different pharmacies, and get those filled. So say go and get 3 different scripts for OxyContin from 3 different doctors. Go to 3 different pharmacies and get those filled. If you don't go to a Walgreens, you know, Walgreens are all connected. They can look and see, hey, you just filled OxyContin 2 days ago. But if you go to a local pharmacy, a mom and pop shop, and then you go to a Walgreens or then you go to a Walmart, that cannot be detected. They can't see that. And so that's where you end up with 300, 600, 900 Oxycontins or Lorcets on the street for purchase. This bill requires that all submitted prescription information to be confidential and not subject to public disclosure under the Sunshine Law, with specified exceptions. Keep in mind this information is under the same form of scrutiny as electronic medical records currently reside. It's a closed-loop system where your insurance company can run a report and send out a mailer to everyone on a particular medication. This is a closed-loop system, and Health and Human Services are not allowed to do that. Law enforcement must obtain a subpoena or court order to get the records. So if a doctor or pharmacist flags it, calls Health and Human Services and lets them know that there's a problem, then it has to take the proper form of action for that to get turned over to law enforcement. There's a 3-year sunset on the pilot project and a 6-year sunset on the bill. In closing, we passed this legislation again with 112 bipartisan votes. No one came to me afterwards, and Representative Engler would probably say the same, and said that they really got beat up at home for voting for this bill. This simply creates a secure way for doctors and pharmacists to maintain and check information about patients who have been prescribed drugs that have a high potential for being abused or misused. Time and time again, we have shown that Missouri's controlled substances are not controlled, and that makes us a hotbed for abuse.
I've had the experience to compare my care of chronic pain in patients from Missouri to patients from Illinois, and it's shocking stories, I can tell you. So you would think doctors would be able to detect doctor shopping and pain management problems easily, but it's not always that easy. The Illinois program allowed us to detect a gentleman over 70 years old who were prescribing a very potent narcotic, who was getting a narcotic medication from a physician in Illinois on a monthly basis. The combination of these medications is potentially life-threatening. Without the program, we would likely have never discovered this. Another patient was detected who was getting 2 medications from my clinic on a regular basis, in addition to seeing 2 physicians in Illinois, getting a total of 6 controlled substance prescriptions every month, going to 3 separate pharmacies, none of which were part of a chain, not communicating with each other. Without this program, this person would likely have never been detected.
Law enforcement is not asking for a PDMP to give us more tools to investigate crimes like the illegal possession or distribution of prescription drugs. Currently, law enforcement has the power of subpoena and search warrant, which has prosecutorial and judicial review. We are simply here to ask for a PDMP so that we can prevent the prescription drug overdose death. The PDMP will be for specific drugs, like opiates, that have the highest and greatest potential for abuse and overdose. We're asking for the PMPD, well, I can't get that down this morning, PDMP, excuse me, because it saves lives. Butler County, which Poplar Bluff is the county seat, has a population of 43,000. We experience 1 drug overdose death every 10 to 12 days. The state of Missouri has the 7th highest overdose rate in the country. In Missouri, drug overdose rates have been on the rise. In 2010, deaths attributed to drug overdose were higher than deaths attributed to traffic crashes. The lack of a PDMP in the state of Missouri is costing Missouri citizens their lives.